Good morning, Tim and Erica. Yeah, they are getting ready to open their doors in just a couple of minutes. They are anticipating and they are able to do up to 1,000 vaccines here today. But I want to talk about some of the heroes and the healthcare heroes that have been making vaccinations like this possible. These clinics are huge, and I'm joined this morning by Dr. Camelia Lawrence. Thanks so much for taking the time.
Thank you for being here with us this morning.
This is such an exciting time, and I know that you are donating your time to be here and volunteering. Why are you so passionate about this?
Well, I'm committed to this. I think the vaccine really offers us hope. It's light at the end of the tunnel. And as healthcare providers, we were first in line to be vaccinated. So now it's our turn to give back and to ensure that every single American has access to the COVID-19 vaccine.
And I think it's pretty incredible. The first day that we were at Hartford HealthCare in Hartford talking about it feels like a man is landing on the moon, talking about the first vaccines going into healthcare providers' arms. How do you think we've done as a state so far, because we have come such a long way and so many more people are getting vaccinated?
I think Connecticut as a state has a lot to be incredibly proud of. I am particularly very proud of the Hartford HealthCare leadership and how they've really tackled this issue and continue to do so. We have multiple mega sites throughout the entire state that were designed with our residents in mind. The goal is to get as many people vaccinated as quickly as we possibly can. I think we're all looking forward to some return to normalcy as soon as possible.
Now, I know something that you are very passionate about is getting those people in our underserved or Black and brown communities vaccinated. How do you think we're doing so far, and what needs to be done to get the state in a better place in that aspect as well?
I think we've made some progress compared to when we first started out, but there's still a lot of work to be done. Communities of color were disproportionately impacted by the COVID-19 pandemic. I can speak from a personal standpoint. I lost my grandfather, and right before the holidays, my father-in-law as well caught the virus and succumbed to it. So I think there's a lot of effort that needs to be done within these communities to help dispel some of the myth as well as the fear that is associated with the vaccine. And I've often said in other interviews that these fears are somewhat warranted given the history of this country, but there's no hidden agenda here. I've been vaccinated. There are multiple members, my immediate family, my mom and my dad, because they're also in healthcare, they also got vaccinated by their institution. So it's safe, it's efficacious, and I strongly encourage everyone to get the vaccine.
Dr. Lawrence, thank you so much for taking the time. I really appreciate it, and thank you so much for everything that you're doing.
Thank you for joining.
For now, reporting in Wallingford, Lauren Zenzi, Fox 61 News. Guys.